This podcast is for you, the modern man. I'm Dr. Truong, your host. I'm an intimate health medical doctor and best-selling author of the book Erectile Dysfunction Fix. I'll do a deep dive into sexual health and performance and how it affects men of all ages and backgrounds. So let's get started, and be sure to visit my website at sexualhealthformenpodcast.com for more information and resources from the show. See you on the inside. Viagra, penile injections and penile implant, hormone replacement therapy do not create new blood vessels to the penis. The Priapus Shot, or the P shot, is using your blood to heal yourself. How is that? The platelets are in your blood. Its function is to create a clot and then start a healing process. Platelet-rich plasma, or PRP, is concentrated from the blood. For instance, the blood is taken about volume of 60 cc of blood, or 2 ounces, and then it is placed in a centrifuge and is injected back. The PRP can regenerate the tissue by increasing blood flow and regenerating cells. When PRP is placed in the penis over a period of weeks to months, it creates new blood vessel and new soft tissue to improve blood flow to the penis and therefore improve the ability to maintain an erection. The Priapus Shot, or P shot, is an injection of PRP into the penis to rejuvenate the penis and restore blood flow. It is prepared in an FDA-approved kit to process the whole blood drawn from the vein. After a few minutes, the whole blood is placed in a centrifuge that spins and separates the blood into platelet-rich layer. This is put into a syringe and then painlessly injected into the penis. This is my favorite procedure. I included a diagram of how the whole blood is processed to make PRP and what PRP looked like. Refer to it in the show note. The P shot offers an appealing, conservative, and often effective step to take before taking ED medication. The P shot enlarges the penis as well and also treats ED by restoring the blood flow problem. You can get an erection within 3 to 6 weeks. The benefit lasts up to a year or more. Some patients may require more than one shot. With each subsequent shot, you will become more sensitive, have a firmer erection, and have a better and more intense orgasm. This painless procedure can improve sex, libido, and relationship. Other benefits are it can strengthen the penis, it can make the penis straighter, as in Peyronie's disease, it can increase circulation in the penis for a healthier organ, and it can increase sensation and orgasm. The P shot can help with lichen sclerosis, which is like an autoimmune disease, or Peyronie's disease, which is bending of the penis due to nodule or plaque development. There is literally no side effects or allergic reaction. Many studies show PRP induces healing and restore blood flow. Let's compare the benefits of Sildenafil or Viagra to the P shot. For Viagra, it treats the symptom. It helps you get an erection, but it's like taking pain medicine for low back pain. You get short-term relief, but no long-term benefit. It has a lot of side effects such as headache, facial flushing, stuffy nose, indigestion, blue tint vision. And you can't get any spontaneity. You have to plan things 1 to 2 hours ahead of time. And if you have a heart condition, if you take heart medicine or prostate medication, you cannot take Viagra. You develop a tolerance to the medication while your disease gets worse. And the satisfaction rate is about 70%. Now let's compare this to the P shot. Well, the P shot treats the source of the problem, poor blood flow, and also increase the strength of the smooth muscle of the penis. It treats the root cause of ED. It's natural, it has no side effect, and you can get spontaneous erection again. It's long-lasting up to a year, and it's no medication. It increases sensation and orgasm, and it gives you 85% satisfaction. P-shot outcome can be affected by factors that affect healing, like decreased oxygen due to heart or lung condition, poor nutrition, smoking, or alcohol can increase healing as well as getting cortisone injection. When can you not get PRP? Well, when you have an active infection or when you have a compromised immune status or when you have a blood clotting disorder or if you're on Coumadin and your INR is more than 2.5 or you have an active infection in your joint or you have a prosthetic joint that is infected. Interestingly, PRP can be used in conjunction with bone marrow and fat stem cell from your own body, and it can be used in advanced cases. And this is an exciting area for regenerative medicine. Research on PRP continue to show advancement and improvement for orthopedic and soft tissue healing. So aside from soft tissue healing for aesthetic and sexuality condition, PRP can be used for pain from arthritis in the knee joint, ankle, shoulders, and hip. Ligament injury in ankle, plantar fasciitis, the sacroiliac joint, the knee joint, and the hip joint from ligament injury. Tendon injury, such as medial and lateral epicondylitis or elbow tendonitis, rotator cuff, and hip tendonitis, as well as ankle tendonitis, especially Achilles tendonitis. And muscle tears injury like hamstring or quadricep tears. Multiple athletes get PRP injection for healing. So who does the P shot not benefit? Well, nothing is perfect. Some patients simply are not good candidates for such procedures, especially those that have psychological ED. P-shot will not be a good choice. The P-shot offers a protocol for enhancing an overall natural synergistic approach to treating ED. For example, you can combine the P-shot with acoustic shockwave therapy, penile pumping, hormones replacement therapy, Kegel exercises, which are exercises that increase pelvic muscles, peptides such as PT141, and healthy lifestyle changes. These treatment modalities are more effective if ED treatment is started within a year or two of first having ED. Safety is further emphasized in many studies, indicating that not only there are no reports of any bad allergic reaction, but it also shows that PRP can reduce autoimmune response. For instance, for like the treatment of Peyronie's disease, the P-shot is probably a safer and more effective than collagenase injection. I see sexual health as going to the dentist for cleaning. You get your teeth cleaned every 6 months to preserve your teeth when you're older. Similarly, getting a P-shot is like cleaning and rejuvenating your penis tissue and blood vessel to preserve it so that way you can use it when you get older. Every man over 40 should get a P-shot for prevention if you don't have ED and treatment if you do have ED. And this is not exclusive for men over 40. Men over 20 can get PRP as well. The P-shot can increase sensation and help maintain girth for younger men without ED. So, are you ready to get a P-shot? You think you are a candidate? I'll see you in the next episode.